Question number 1. A client with a history of myocardial infarction is scheduled for a stress test. Which of the following should the nurse instruct the client to avoid before the test? A. Eating a heavy meal. B. Taking a shower. C. Drinking water. D. Using nicotine. Answer. D. Using nicotine. Rationale. The client should avoid using nicotine before a stress test because it can affect the heart rate and blood pressure, potentially interfering with test results. Question. A client is being evaluated for heart failure. Which diagnostic test is most useful in confirming this diagnosis? A. Electrocardiogram, ECG. B. Chest X-ray. C. Echocardiogram. D. Serum electrolytes. Answer. C. Echocardiogram. Rationale. An echocardiogram is the most useful diagnostic test for confirming heart failure, as it provides detailed information about the heart's structure and function, including ejection fraction. Question. A patient is admitted with acute pericarditis. Which of the following symptoms would the nurse expect to find? A. Sharp chest pain that decreases when sitting up and leaning forward. B. Dull, achy chest pain that radiates to the left arm. C. Crushing chest pain unrelieved by rest or nitroglycerin. D. Chest pain that increases with deep inspiration. Answer. A. Sharp chest pain that decreases when sitting up and leaning forward. Rationale. Sharp chest pain that is relieved by sitting up and leaning forward is characteristic of acute pericarditis. This position reduces the pressure on the pericardium. Question. When teaching a client with newly diagnosed hypertension, which of the following lifestyle modifications should the nurse emphasize first? A. Smoking cessation. B. Reducing dietary sodium. C. Increasing physical activity. D. Limiting alcohol intake. Answer. B. Reducing dietary sodium. Rationale. Reducing dietary sodium is often emphasized first as it can have a direct and immediate impact on blood pressure levels. This is a key modifiable risk factor. Question. No. 5. The nurse is assessing a client who has just undergone coronary artery bypass graft, CABG, surgery. Which of the following findings should the nurse report to the healthcare provider immediately? A. Temperature of 99 degrees Breve, 37.2 degrees. B. Urine output of 25 μH. C. Heart rate of 90 beats per minute. D. Blood pressure of 130, 80 mm Hg. Answer. B. Urine output of 25 ml/H. Rationale. A urine output of less than 30 ml/H may indicate decreased renal perfusion and should be reported immediately as it could signify serious complications.